When I see patients, I try to make them as comfortable as possible. I treat them as if they're a family member of mine, try to address their concerns and fears, and hopefully in the long run we can achieve the best possible outcome for them and their family, enable them to continue doing everything they can possibly do in their normal everyday activities. Many of the patients who come to us have a diagnosis of a brain tumor, and often that's a very scary diagnosis. It turns out that many of these tumors are slow growing and benign. Some turn out don't need any treatment at all. Some we just observe and watch. Some do need some pretty intensive treatments, including surgery and other therapies such as radiation and chemotherapy, and we try to guide them through that so that they can have the best possible outcome and with the least amount of possible side effects or other problems related to their treatments. I think in general, in our region and in fact in our nation, people recognize the caliber of what goes on here at Siteman Cancer Center, Washington University, and Barnes-Jewish Hospital. And I think there's a certain comfort in that. When we have these initial discussions with patients about all the different treatment options and the nature of their condition, it's overwhelming. And these are potentially disabling and even life-threatening conditions sometimes. And to have the patient recognize of all the things that we have to offer here, give them the best opportunity to make the best of some of these situations, which can be challenging at times, and also to comfort them through that process. When a patient comes to see one of us, whether it's the neurosurgeons or the other specialists in the Siteman Cancer Center for brain tumors, they may interface with one of us, but in a sense, every patient gets a team approach because through our tumor boards and our interactions with our colleagues, we're constantly sharing information and seeking additional opinions, trying to get the best possible treatment for each and every individual. And even after having done this for nearly 20 years and had the honor and the benefit of treating hundreds of patients, each patient has something new or different that we need to evaluate. And often we learn a lot from our colleagues who may have seen similar such situations and help guide those treatments.